Okay, thank you everyone for bearing with us. This is a new venue for us, obviously, and it's also the first time we're having breakout sessions, so we're still kind of feeling our way through managing that, but we appreciate all of you coming back in for our next session, What's New in New Jersey? There's been a lot of talk about what's going on in New York right now, but the truth is, a big part of the innovation story is unfolding in New Jersey right now. All of those old pharma campuses in suburbia are being completely repurposed and renovated into thriving hubs of innovation right now. And so what's going on there is you're seeing when the pharma companies shift strategies, it affects the whole industry, but there is an adjustment within the industry, and this is what we're seeing now in New Jersey. So welcome to our panelists. We're welcoming Sho Islam, the Director of Business Engagement for Middlesex County, New Jersey, Nancy Tyrell, the Director of Academic Partnerships for Portal Innovations, Michael Zwick, Senior Vice President for Research at Rutgers University and the State University of New Jersey, and John Coelho, Senior Advisor of Life Sciences for New Jersey Economic Development Authority.
Good morning, everyone. Can you guys hear me? There you go. Good morning, everyone. Sho Islam, as Nancy mentioned, Sho Islam of Middlesex County, Office of Business Engagement. Nancy, thank you for having us over. I think this is the third year of us being here, so we'd like to always talk about what's going on to the other side of the river here in New Jersey. I think we have a lot of things going on. My office particularly is a county office, county government. We really try to strive to make sure all of our life sciences businesses throughout the state get enough love to make sure they do business, grow, and that if we could help them accelerate their growth in any way. And that really involves working with our partners from the state, from universities, from our partners at incubators to ensure that all levels of support are really provided for them to maximize their potential. So that's the Office of Business Engagement. I'd be remiss if I didn't mention my colleague, Dr. Kalindi Bakshi, who's here, my partner in crime there. So Kalindi, thank you for all that you do. With that, I'll pass it on to Nancy. Nancy, go for it.
Hi, Nancy. Thank you very much for the invitation to participate in today's panel. I'm Nancy Terrell. I'm Director of Academic Partnerships at Portal Innovations. Portal is a venture capital development engine. We provide our three pillars are funding for the startup companies that are focused in life sciences, helping scientists who have an idea, especially that are originating in the academic labs. In this instance at Rutgers and even Princeton and NJIT. Or any of the hospital systems in the New Brunswick and New Jersey area, providing the lab space that supports the endeavors that they are undertaking and the shared equipment that they can make use of as a small startup company. So providing the incubator space for these life science groups. And finally, the human capital to support the ongoing research that the scientists are taking on. So many of the scientists that decide to start a small company to advance their discoveries out of the labs for the universities that they are embedded in, they need some help just getting the company started, kicked off. How do they do it successfully, not just from a funding standpoint, but from advice on a slide deck and how to pitch to potential investors, things like that. So Portal Innovations is so excited to be the operator and manager at the Science Incubator within the New Jersey Innovation Hub at the HELIX in New Brunswick, New Jersey. I'll turn it over to John, and he'll tell you more about what the NJ EDA is up to these days.
And just for everyone out there, John is the state's bank, so he does have checks ready to go. Talk to him afterwards.
I didn't pay him to say that, I promise. So I'm John Coelho. I'm a physician scientist with the Economic Development Authority of New Jersey. We're a quasi-government authority that really sets, I called it 2 years ago, the investment thesis for the state. You know, what is our outlook? Which way should we go? Position between New York and Philadelphia and in the Northeast. And our focus on diversification, which I'll talk about in more detail, as well as the strategic innovation hubs, which Nancy Terrell at Portal Innovations is going to be managing one of them. We have several that are cropping up in the state. From my background, working at both Pfizer and Merck, and then in cell therapies, you know, I'm very excited to really see the big giants, the Johnson & Johnsons, Bristol Myers Squibbs, you know, and Novartis's and Merck's, look at, as they change their model, go towards repurposing some of their facilities and opening them up to many companies. So for instance, Bristol Myers Squibb, a property in central New Jersey, became 4 new companies, you know, advanced gene therapy, contract manufacturing, Beijing or Bay1, which is a biotech company. So we're seeing a tremendous growth in that respect. I think and for the second year, current through July, we're seeing pretty steady growth across the state. Very proud to talk to you about the 40 or 50 programs that we have that span tax incentives, venture programs, technology investments, life science funds. But really, we're really a partner, I think, for this sector, for companies that want to move to New Jersey. I'll pass on to Mike Zwick, my esteemed colleague at Rutgers.
So with Mike, one of the things he does, amongst many other things, is, of course, if you ever need a mice whisperer, Mike's the guy. He runs vivariums, quite a few of them. So, Mike, it's all yours.
Yeah, good morning, everyone. My name is Mike Zwick. I am a human geneticist, so professor of genetics in Rutgers, New Brunswick. I'm the senior vice president for research at Rutgers. And so I'm the chief research officer, institutional official for Rutgers University. I have a separate career path that's unrelated to my scientific career path in that I'm a former naval officer, served on a ship. I'm a Desert Storm vet, Iraq War vet, served on a ship out of Rhode Island, had 25 years service, 25 years and 1 month and 4 days, actually. That's how we count it in the Navy. But in my role at Rutgers, I lead a team of 300 people, and we manage all the sponsored awards, all research contracts, IRB, IACUC. As Sho mentioned, I run 17 animal facilities. We have 250,000 square feet of animal facilities. All intellectual property, licensing, startup companies, all that come out of Rutgers. So we're part of every faculty member's team at Rutgers. We have 1,600 faculty members who have at least one grant. We have about 4,500 grants in our funded portfolio. I think one of the things that is perhaps not realized or recognized, I've been at Rutgers for 4 years, but about 12 years ago, Rutgers University merged with UMD&J, bringing all the life sciences into the university. And this has fueled tremendous growth. So our funding, our sponsored award funding at Rutgers last year went up $25 million in spite of all the complications with the federal government. We're approaching $1 billion. We had $993 million of research last year. Life sciences is the particular area of growth, and our funding has grown 41% in the last 5 years. So I think when we think about a large ecosystem, and we're very lucky to be located in New Jersey, where 14 of the 20th largest pharma companies are located, Rutgers Life Sciences is growing like gangbusters, and there's actually tremendous opportunity and I think synergy between the State University of New Jersey, it's both the name and the mission, and the research that we're doing. And one quick fact I'll give you, one final fact I'll give you is we did a recent, we recently asked what proportion of our faculty work in an area broadly around brain health. And it turned out to be about 401 faculty out of the 1,600 work very broadly in brain health. So this is from basic neuroscience to very clinical. So we have enormous strengths in neuroscience in the brain, which in my opinion is the greatest unsolved problem in biology. And so I think that's a really fantastic opportunity for connecting with Rutgers, and glad to talk more about Rutgers in the panel.
No, thank you very much, Mike. I think before we get started with everyone, I just want to level set. and give you a little background for those who may not be familiar with what's going on in New Jersey. By the numbers, just kind of snapshots. 50% of all FDA drugs that was approved in 2024, those companies have footprints in New Jersey. If you look at number one in the nation for FDA-approved facilities for drug manufacturing, that's in Jersey. Number one in workforce for life science, that's also Jersey. All to say that we oftentimes in New York City forget the fact that our neighbors in Jersey, that we're all from, has lots of infrastructures, lots of talent. The location is there. So I heard earlier that incubators have wait lists. We're more than happy to talk to you and try to see if we could assist you. So ready to bring it on. And it supports about 350,000 jobs in New Jersey, and approximately about 20% of the state's GDP comes from life science and its affiliated industries. Some of the projects that I want to quickly go over, as John mentioned, the Strategic Innovation Center that the state really has taken a deep understanding in what the key sectors are, how do we support them, where do we place them, and how do we encourage the growth of those sectors. So one of the newest one that's announced is at Rowan University, all the way South Jersey near Camden County. It's specifically, that's really a multidisciplinary center that's going to have plug and play in it. So if you know Plug and Play, they're an accelerator. They invest in companies and they help companies grow. So that's going to be one. City, North Jersey, Jersey City. That's a mixed-use space where you could have kind of your live, work, play all in one spot in the center of all the actions. So that's going on. And then, of course, HELIX, a generational project, I would say, in a center in the heart of the state, right next to the flagship university of Rutgers University and the premier university, Princeton University. So both of them are there within a stone's throw of each other. We have 4 incubators now with Portal coming in that are supporting life science industries, all within 15 minutes of one another. So again, if you're thinking about R&D work that's going on and research that's going on at Rutgers, it's certainly fueling that innovation and companies spinning out to something that they could monetize and help humanity at the end of the day. And then the last, I think John mentioned or alluded to a little bit, the former Merck facility in Kenilworth, that's been repurposed and ready to go, spaces available there. If you consider and look at all of those sites, you have sites that are across the state, north to south, whether it's a Philly market in South Jersey at Rowan, or it's a New York City metro market in Jersey City, or right in the heart of the state in New Brunswick. Its coverage is quite phenomenal. And the common theme, I would say, throughout all of those 4 sites, it's collaboration, it's mixed use, multi-purpose. And the idea is that more and more life sciences really converging with technology and other industries, and we want to make sure we're at the forefront of supporting such companies. So with that, maybe I'll pass it on to Mike. I know Rutgers has significant space coming up at the HELIX. Can you talk a little bit about what specifically is the capacity that's going to be there for Rutgers and what sort of work you'll be doing there?
Yeah, that'd be great. Love to. So the HELIX is, let me give you an overview quickly. The HELIX, as you saw, is about 1.5 million square feet. It's going to be 3 buildings in total. HELIX 1 is the building that's going to open up May 1st, and I'll talk about that in detail. Building 2, the ground has been broken. That's for Nokia Bell Labs, so they're moving from Murray Hill, and they're going to be right next to us in the HELIX. And then Building 3 is still in design and development, but is going to have a variety of other research focused in engineering, perhaps in food innovation that will be in this building. So HELIX 1 is a 12-story building. There's 4 floors of translational research. Right now, Rutgers has identified 5 programs that are going to be in that facility. We've identified about 45% of the faculty. We're going to be hiring new faculty in that facility. The Robert Wood Johnson Medical School is going to be moving from Piscataway to be in New Brunswick. The contemporary approach for educating medical students is much closer engagement with patients from the very beginning of their medical education, and this location allows them to interact with our affiliate, Robert Wood Johnson Barnabas Health, because the hospitals are right adjacent. There's a particular focus on MD, PhD, clinically focused research in the hub, in the translational research space, where we're really trying to take ideas and pursue research lines that solve key problems. The Innovation Hub, I will let Nancy talk about the 3 floors in the Innovation Hub, and then the 12th floor is a vivarium. So it's a 30,000 square foot animal vivarium that will be part of my portfolio. This will be Rutgers has among the most advanced vivaria in the world. So this vivarium actually is going to have robots that basically similar to what Amazon uses to move packages around. We're buying them in the facility. We're a completely digital vivaria, so we have really no paper. We use RFID to scan cages. We actually we're a center of excellence for a company called Technoplast that's using digital ventilated cages. So these are cages that have sensors built into the bottom of every cage that allow you to track the motion and activity of mice 24/7. So this has operational efficiencies because it allows us to detect when mice might be getting sick or when cages need to be changed. But it also gives free data to our faculty that these data can be analyzed through AI algorithms, which we're exploring. So for example, there are some interesting examples of mouse models of human disease, say Lou Gehrig's disease, ALS, where you actually begin to see a phenotype in the mouse far before you would see actually a clinical presentation. You see sleep and motion changes in mice. So this could be a really powerful tool for our investigators. And so this is what we're doing this in the HELIX, but we're in fact changing over cages throughout our entire facility right now. And I think one of the things that I have heard is for startup companies who need to do preclinical research, who need access to facilities that can support research in mice, or we'll have large zebrafish capability in this building. This will be a real game changer, I think, for a startup company, because you'll basically be able to ride the elevator up and your animals will be right there, and you come back into Innovation Hub and you'll be able to really accelerate your work. And I think that will be a really invaluable resource for startup companies in that space.
No, that's great to hear, Mike. And I guess one of the ideas behind the HELIX itself is collaboration, right? Going from lab side to bedside to commercializing products. One of the things I know with Porto coming in, that you're taking up some space to put on programs, not just the incubator, but all the affiliated, including some of the things that Porto is unique for, investing in companies, running programs throughout the year to advance and grow the ecosystem. Can you talk a little bit about that, Nancy, kind of what you guys have been at Porto Innovation tasked with at the HELIX?
Sure, I'd be happy to. So on the 9th floor of the HELIX building, we will be sharing the floor with the NJ EDA, so John and I will be neighbors up on that 9th floor. And I want you to all picture how different it's going to be for a lot of the scientists who are used to being buried down in the basement in cinder blocks and little slits for windows, are now going to be floor-to-ceiling windows up on the 9th floor with a view of the whole area of New Brunswick and beyond. The greatest county in the land. Thank you for that plant. They will be enjoying natural lighting coming through to their workspace all day. In addition to sharing equipment and attending programming that Portal will be putting on to help the entrepreneurs get off successfully. So in addition to providing, let's say, Portal Pours, where it's a happy hour and we're just getting all the member companies into the town hall space to talk about what their science is and what their needs are and how other companies might be able to collaborate and help that need, or just finding ways that they can work together. We will also be providing space for investors. The Evergreen Fund for New Jersey EDA will have offices there right amongst the startup companies. So, when you're having programming and education, not only education, but also informal events where you can enjoy a happy hour with potential investors, you're kind of rubbing elbows and stumbling upon ideas. And I think the fact that the EDA wants to share the space and the fact that the investors will be there amongst these startup companies provides great hope that more investments will be coming in, the companies will get stronger, they'll be able to develop and graduate out. They'll now take a graduation suite within the building on a different floor so that they can still stay part of the community. For these life science academic co-founders or founders of their own new startup company, these are very impactful interactions. They're very impactful strategies that they can implement. So we're excited about not only the strategic programming that we will provide on a regular basis, but also the informal partnering that can help some of the companies grow and position for future funding.
I like the happy hour part. That was really good.
You're all welcome.
And especially since we're going to be neighbors right there in the other building, that would be great. I could always walk over.
That's right.
John, now EDA is really the linchpin that's been kind of spearheading a lot of these statewide efforts from, again, north to south. Can you speak, and you've been especially instrumental in the strategic innovation hub deployment. Can you go into depth a little bit about some of the ones that I mentioned before, but what's the thinking behind it? What do you see as its future? And talk a little about the innovation hubs.
Thank you. Yeah, so diversification is really central to our investment thesis. When you think about the model of discovery or the evolution of clinical development, drug development, clinical development, and then commercialization, I think the states and the areas that are going to really win are the ones that play in all. Because you need today in biotechnology a companion diagnostic, for instance, to help you with liquid biopsies, to advance a particular drug, or in precision medicine. I'll give you an example. Just this past week, Guardant Health, based in Palo Alto, California, did a major deal with Quest Laboratories in Weehawken, New Jersey. Now, this is very important because Quest will nationally deploy the first blood screening test for colorectal cancer. And we all know no one really likes that test, the current standard of care, but this is a game changer, given the precision and the ease of use. So we see partnerships and collaborations very key. I'm going to just lean on Mike's point. Rutgers is a great institution, but it needs the proximity to industry tenants like Johnson & Johnson, like Bristol-Myers Squibb and others on the commercialization aspects, and then the hospital like Robert Wood Johnson to prototype and advance their innovations. And they have many fine companies within them. This is really, really important. So it's that mix of three. The Roan collaboration that show displayed was very important because I felt we were overtly concentrated in the northern part of the state, and really the Philadelphia area is a big gene therapy and cell therapy capital for the nation. So we've put 2 centers in that part of the state. The first, I'm very proud to talk about this because we worked very hard over the last year and just at the groundbreaking, is the legendary Coriell Institute Cell Biobank. This is where the first polio virus was incubated and a lot of the early experiments were done. And we've invested in that center as a strategic innovation center for epigenetics and cell and gene therapies. So that's just in Camden, New Jersey, just outside, 10 miles outside Philadelphia. And that's next to Cooper, MD Anderson, and Rowan Cooper Medical School. The second one is the Rowan MedTech facility, which is going to have computational biology because of significant computing power that we have in that part of the state, robotics. We're seeing so much innovation in orthopedics. So I'm very excited to see what can come out of that because I think that will be a really important component we haven't really done enough in. So if you see the array, and then the last one, SciTech City, which is near Jersey City, I was just there yesterday. We met many companies from all over the world. I have to say it's been overwhelming and awe-inspiring to see all these companies come over to our state, visit us, and say, how can we be a part of the great experiment that we are having here? And the one thing they see is this, the opportunity in different sectors. So a medtech company from Korea could come in with a new HIV test with a 99% precision and say, we'd like to maybe consider the HELIX when it's ready because they'd like to work with Mike's scientists. But if it's not, can we be in your biosciences center till it's built. So it's a mix of the co-location of these three disciplines, and I'll talk a little bit more about the talent pool. The SciTech City also has a digital innovation health focus, and we've already launched, although the structure is not built yet. Sheba Medical in Israel will be managing that facility, as does Portal Innovations manages the HELIX. And Sheba is going to build a world-class hospital of the future and digital innovation model, which we think is really going to change how we approach streamlined care. There's so much inefficiency in the healthcare system, whether it's insurance claims and things like that. We've got to cut through this. So we've launched a cardiovascular health pilot sprint already before the structure is built, because I just can't wait. And when those companies come to me, I say, well, I'm happy to talk to you about Evergreen or Angel Match and some of the programs we have, because I want to see these companies grow. I don't worry too much about what's happening at the federal government level, because personally, we've seen a lot of outreach, partnership, the biotechnology bipartisan meeting that happened in Princeton on June 1st, where they're investing $15 billion in the nation in biotechnology. That's a first. So we're seeing a lot of opportunity in partnering, not just internally across stakeholders, but with the federal government, because I think this is the tone we have to set. Thank you.
No, thank you for that. And as you mentioned, one of the things that really you pointed to was having facilities that are cutting edge, that researchers can work. Mike, if you could speak a little to what do those cutting edge infrastructures provide in terms of attracting top tier researchers and fast forwarding cutting edge research?
Yeah, glad to. This is an area of personal passion. I wrote a paper about this in 2021 about how universities should organize their research core facilities. And I use the term force multiplier, which is this term from the Navy. And I want to give you an example. I use this analogy frequently. So when I was on board the USS Kaufman, my ship in Desert Storm, we had this newfangled thing called GPS, and it was encrypted. And we were the only ones who had it. And so it turns out in the Navy, when you know where you are on the planet, you can do all sorts of missions dramatically better. So you can have a missile hit something that it's supposed to hit and not hit things it's not supposed to hit. Or in our case, we drove through a minefield and we'd have all these civilian tankers behind us because we knew where we were and the tankers didn't know where they were with sufficient accuracy. And so I think of core facilities as that sort of investment. These are strategic investments that universities make, and they make many parts of our mission dramatically better. They help our researchers, they provide opportunity and access to all our faculty members to get access to key platforms. They're efficiently done, right? We can't buy every faculty member their own mass spectrometer or their own DNA sequencer. So we have to share, and this is a mechanism for doing that. We can use this to advance our students and academic experiences and training. But I realize that this is actually something that can be used very powerfully for companies. That there are a lot of startup companies that need access to a platform with a well-trained scientist who can actually generate data for them that they need to take their next step towards commercialization. And so before I came to Rutgers, I was at Emory University in the School of Medicine for 16 years. And while at Emory, I set up something called the Emory Integrated Core Facilities. It ended up being 18 core facilities and the animal resources that centralize this across Emory. I got every public university in the state of Georgia to agree to share these sorts of core facilities so that faculty could move, and then companies could come in and use this. And so I've brought these ideas to Rutgers. And so what this means is we try to make it really simple. So we have like a one-page screen where a company can come in. They hit a button, say, accept terms and conditions. We make no claims on any intellectual property or anything that's generated. The data is the company's data. We're just providing the service. Our benefit is that we have these substantial investments. We usually have some spare capacity, and it's a really valuable service to the economy. And we build relationships in this way. New Jersey, we've been extraordinarily benefited from the Commission on Science and Innovation Technology, which provides $40,000 grants to startup companies to come use core facilities throughout throughout New Jersey. Last year, we received $1.2 million in revenue because we had so many startup companies that were coming onto our campus to use different core facilities. We have a collection of about 40 of them. My job has been to organize them and make them make sure the rules under which they operate are clear. But this will certainly be a strategy in the HELIX, because any company in the HELIX is not only going to have access to core facilities like our animal facilities, which are our largest research core facility, but anything across Rutgers, whether it's in Newark or it's in Piscataway or New Brunswick. And I think this is a real difference for a company. I mean, companies can there's lots of reasons why companies can fail. We don't want it to be that they didn't have access to a key technology at a critical time. And so that's sort of how we partner with faculties.
No, thank you, Mike. And
Sorry,
Nancy,
startup companies.
no, Nancy, this is not a layup. So it's a question. John laid off the infrastructure for you. Mike has the research for you, and I know Portal is all across the country in some of the major hubs for life sciences. What made you guys want to, participate in New Jersey's ecosystem, and what makes you so bullish on New Jersey's life science ecosystem, particularly?
We're especially excited about being in New Brunswick, New Jersey, and it goes back to our history. Our management and our founder, John Flavin, got a start in a CRO, a startup CRO outside of Chicago, and most of the companies that we sold to were located here in New Jersey. So we often made trips to New Jersey and New York as well to find out if these companies would be contracting out their medicinal chemistry, any combinatorial chemistry, any biology or services that they might need outside of their pharmaceutical core. So going way back to the start of his career, John Flavin recognized the history, the tradition, everything that goes along with New Jersey and the commitment to life sciences and pharmaceutical. And to learn about this new project at the HELIX and how this science incubator could be used to help Rutgers faculty start their companies. It can be used as a recruitment and retention tool. When new faculty are being recruited to Rutgers, the idea that they might be able to start a company that would help them advance the research that they're currently doing in their own lab and bring it to a patient with the help of a science incubator and a manager and operator like Portal to help them do that successfully, I think is a wonderful tool to keep the faculty that you want to retain and to recruit new faculty that might be interested in doing exactly that. So we've been excited about New Jersey for a long time, and when the opportunity came up for us to apply to serve as the manager and operator of the science incubator, we did that immediately, and we're thrilled when we were chosen to serve that role.
Thank you, Nancy. And in that role, as you mentioned, startups and even large companies that we have in New Jersey, one of the things you alluded to earlier are some of the programs, and Mike, you alluded to the CSIT and the voucher that's available to startups who may be looking to utilize core facilities. John, I know the manufacturing voucher program, which is one of the incentives, is currently open. Can you highlight few quickly, from small to large programs that really you enjoy as far as how it helps companies bring their research to the next stage that's available from the NJEDA?
Certainly, and I can't say enough good things about Portal. They're just phenomenal to work with, and you just have to visit their facility in Texas and in Boston. They're really, you have to think about a bespoke approach to each company. So from the Commission on Science, Innovation, and Technology, a sister organization, smaller sister organization within the NJEDA that Mike referred to, 40, 60,000 grants for seed funding upfront or catalyst grants. We have, an angel match program that just doubled under the federal allowances that gave us from 500,000, now it's up to $1 million that we can match, which is terrific for companies in an early stage. Also, there's a change in the angel investor tax credit very recently. So if you were investing in one of Mike's companies at Rutgers, historically you could get only 20%. Starting next year, it will be 35% in a refund for an external investor, which is very attractive for people, investors, and VCs. Some of our premier programs, which I'm really happy to say, the source of the funding is from tax auctions that we do in the state. And so profitable companies, participate in these auctions, and we gain the proceeds of that and redeploy them towards the Evergreen Fund. The Evergreen Fund gives up to $5 million plus as an award that's at least reviewed by our board of directors. And we've doubled the number of companies that we support. One of them was, I'm very happy to say, proud about this, MIT, Bob Langer's lab spun out a company, and they decided to move their commercialization component to New Jersey. So we have them in our Biosciences Center. Happy to welcome them. We were ready to talk to intracellular therapeutics. They came over from New York, that was mentioned earlier. They had a really great schizophrenia drug, born in New York, came over to New Jersey in October of 2024. And they were acquired by Johnson & Johnson in 25 in Bedminster, New Jersey. So happy to see that they're starting to see our programs as very attractive. Our premier program is the Life Sciences Fund that we pass on, have companies, 4 VCs invest our funds annually, and we rely on them to do the due diligence. And it is stage agnostic and indication agnostic. And it's up to $10 million that we award. So this is a really premier fund, which I think I'm seeing a lot of interest from companies at this stage of the game. I'll just say just a small point about how we can operate better, because the intracellular example or some of the others, maybe you want to do your discovery in Massachusetts in biotech, but we're really very strong in commercialization because we have the industry giants there who have produced Opdivo or Keytruda or cell therapies. We make about 40% of the cell therapy, CAR T therapies in the nation today within the state, and that's going to expand. And this tax credit, the next tax credit, gives you up to between 20 to 150 million that you could apply for, but you have to put in approximately $10 million of your own investment, commit to hiring 20 people, and there are some other factors for the tax credit that's applied over 5 years. The tax credit is also transferable. So I'm seeing some fairly strong demand from existing companies like Novartis and others that are applying for this tax credit within our state.